on here. So here we are. Hello, hello. We are going to be talking about the pain of labor. I am sitting here freezing in my bedroom because my mom is visiting. So if you don't know who I am, hi, nice to meet you. My name is Trish, or Labor Nurse Mama, as many of you guys know me. I am the founder and creator of the brand Labor Nurse Mama, where we empower and educate women to take control of their birth journey. I have a 16-year high risk labor and delivery experience, and I'm a mom of 7. So I know it from both sides of the labor pain, or the labor bed. I have had over 15,000 students, and what I know about women who are pregnant, there's some top concerns that we hear, and we hear this all across social media. But one of the biggest things is fear of tearing, and the other is the fear of labor pain. And it might mean like, I'm afraid that I won't be able to handle it, or I'm afraid I'm going to freak out. I'm afraid I won't know when I'm in labor. So today we're going to talk about like the top ways that you can handle it. We're going to talk about some hacks. So everybody always like, Trish, like, what's the best coping tool? The number one coping tool is knowledge. You have to understand the pain of labor. Just like anything else in life, the more you understand what is happening, the more calm and confident you will feel, which is why my birth courses are called Calm and Confident, Calm Labor, Confident Birth. The more knowledge you have, the more calm you'll be. So that's your number one labor hack, like labor pain hack, is to be knowledgeable. Understand like what's going on inside of your body, what to do when. So the second hack would be knowing tools. Like the best thing you can know is how to move your body, how to position your body so that you can cope with the pain of labor. Positioning and movement is your top tool. That is the top tool. And yes, I teach all the fancy different types of positioning to help the baby get into the canal, how to get the baby into optimal positioning. But really, it's all down to instinct and listening, learning how to listen to your body while you're pregnant, and using those during your early stages of labor, all through active labor, transition, and pushing. So that's your second hack. Your third hack is breathing. Being able to control your breathing is so important, and you can do that with a few tools. But the number one breathing technique I teach, I don't do any of the or any of that, is taking a deep breath in for 4 seconds, hold it, release it for 6 seconds. Super simple. So you just breathe in. That one actually works on the next tool, which is the most powerful tool, and that is your mindset. Birth is 90% mindset. So if you can stay in charge of your mindset, if you can stay in control of your mindset, and that means like, what are you telling yourself about what's happening? What are you telling yourself right now about the pain of labor? Are you only thinking negative thoughts? Are you thinking, oh my God, it's going to be horrible, I'm going to freak out? Chances are, if that's what you're thinking, that's what you're going to do. So we want to flip that right now. And every time you start to go into that fearful mindset, I want you to flip it to, my body is powerful and I will handle the pain of labor. So I want you to like out loud say that and understand that you get to control how you perceive the pain of labor. The last hack that I'm going to tell you is this one. I'm going to do a little bit of demonstration. So you have what you call is your pain threshold. It's right here. Then you have your pain tolerance. So your pain threshold is anybody that hits a pain threshold, that's when their brain says, oh my God, this hurts. When you hit your pain tolerance is when you need help. So this might be when you bust out your mindset, your breathing, your coping, your positioning tools, or get an epidural, depending on what your plan is. So you can actually raise the threshold before you step foot into the labor room. This is really important to know, because the higher you raise your threshold, that means you're not going to think this hurts. And my students on average get to the hospital at 7 to 8 centimeters, and they're not freaking out and like pulling their hair out and screaming and looking like, a TV version of birth. They're calm and they're thinking, I hope I get admitted. And then the labor nurse checks them and they're like, holy moly, you're 7 centimeters. Of course you're getting admitted. So what TV and media and people show us as being at that point in labor is freaking out and losing control and a mom screaming for an epidural, but it doesn't have to be that. You get to decide. So you can raise your pain threshold by learning what you need to